Good afternoon, Jason, and thanks again for you and Channel 14 for having me on to talk about the pandemic that we're in the middle of. And I guess this week is kind of a story of good news and bad news. The good news is, if we remember from last week, we had the announcement that Pfizer had a vaccine that they plan on rolling out in the very near future. And today, another drug company, Moderna, also released the information that they are also planning on rolling out a vaccine with even a higher rate of efficiency at 94.5%, they claim. And so between the two of them, there certainly seem like it's safe to say that help is on the way. That said, I'm afraid that that is still very, very dangerous situation out there. And just to speak to that a little bit, let's take a look at some of the numbers. In the United States, we now have nearly a quarter of a million people. So it's approaching a quarter of a million people. I think the number is 248,000 as of yesterday. In Wisconsin alone, there's over 2,759 with a dozen people dying, passing away just yesterday, and one in Kenosha County as well. So we are certainly in for a rough fall and rough winter. So I just don't know exactly how to stress just how serious of a situation that we're in. This past week, the Kenosha County Health Department did make a recommendation that all schools in Kenosha County close down. It's strongly recommended that they close down between the after the last day of Thanksgiving, before the Thanksgiving break and until after the New Year's break. And Parkside is heeding that warning. At this point, Kenosha Unified is not. So I think that will be a subject of discussion at the school board meeting tomorrow. And it seems to me that this is pretty well thought out in terms of, this is gives everybody kind of a period of time to get used to the idea of virtual for a short period of time. And, we know that people are going to be traveling during this period of time, and so there is going to be a higher probability of infection. So it seems to me like this was a well thought out recommendation by the health department. Let's see. Another bit of the bad news is that it looks like there is going to be possible problems of distribution of the vaccine. We know that President Trump has not attended any of the meetings of his committee on coronavirus for the last several months, according to Dr. Fauci. And President-elect Biden, of course, has his new coronavirus task force in place, but does not have access to the cooperation that I think would be certainly helpful in terms of how to go ahead and distribute the vaccines when they become available as early as next month. So hopefully that can get resolved by sometime next week, and we can start planning on getting the people who are caring for us in hospitals and nursing homes, get the frontline workers, get them vaccinated, and then also elderly people, especially those with underlying conditions, get them vaccinated as soon as possible as well. Governor Evers on Tuesday gave what he said was a very strong recommendation that we start taking all possible measures very seriously, including staying at home whenever we can, and really limiting our travel and limiting our distancing with anybody. And we need to take the mask seriously, and we need to wash our hands more frequently, and keep our hands off our face, and social distance. And currently, one of the reasons why the crisis that we're in now is because the virus can last much longer on surfaces in cold weather than what it does on warm weather. And of course, we also know that we are going to be outside less. So we need to double down on our efforts to try to keep this virus at bay and stop the amount of deaths for the next few few months as we approach the probability of having a vaccine that we can actually beat this virus with. And we know that a lot of people are having a tough time in this situation, understandably. We're all social beings, and not be able to spend time with their friends and family as much as we'd like to. It's hard on a lot of people, hard on all of us. But for those of you who are having a particularly rough time, maybe abusing alcohol or drugs or having problems with domestic violence, I encourage you to call our office at 608-266-0455, and we will send you in a direction where you can get some professional help, no matter what the problem is. And if you're having a problem with unemployment, and we know that some people are still having problems with unemployment, and of course there's people who are recently laid off as well. So don't hesitate if you're having that problem or any problem with the statewide issue as well. But there's never any shortage of news when we talk about this situation, Jason. And I just want to wish you a good week ahead, and stay safe. And same to all your listeners. Let's stay safe out there. Let's make it to the point where these vaccines make us safe to start getting back to some level of new normal. Before I close, I think that it's only appropriate that I think it's this evening that the Kenosha City Council will be taking up a resolution on masking and also distancing in bars and restaurants, I believe, and retail as well. So we'll talk about that next week, but I believe that's on the council agenda tonight. If you're looking for something, you can tune in on the internet, and should be an interesting debate and interesting vote. So once again, if you're having problems, give us a call, 608-266-0455. Jason, I'll talk to you next week.